Welcome to Locumotive's revision tips. Today we're going to talk about pigment dispersion and pseudo-exfoliation. We're going to split this video into two parts, so look forward to part 2. Pigment dispersion and pseudo-exfoliation is really important within optometry due to both of them being a secondary cause to open-angle glaucoma. Pigment that gets stuck in the trabecular meshwork causes an increase in intraocular pressure. This causes damage on the optic nerve and glaucoma as we know it. So how does pigment dispersion happen? This tends to happen to myopes who has a different anatomical relationship between the ciliary bodies and the lens. This results in the iris profile becoming concave. Iris in these eyes can bow posteriorly, causing chafing against the zonules. This situation is called reverse pupillary block. Friction causes a release of pigment into the anterior chamber. And this is that classic transillumination that we see on our slit lamp. The pigment settles in three main areas. The cornea, which we call Krukenberg spindles. This is a band of pigment sitting at the back of the cornea. We also see lens pigmentation, again, pigment on the lens, and trabecular meshwork pigmentation. This is only seen by gonioscopy. As the pigment settles within the trabecular meshwork, it reduces the current within the aqueous humor. This causes an increased intraocular pressure, which leads to secondary glaucoma. This is commonly found in myopes within the 30s and 40s. When examining a patient, we'll be doing a detailed slit lamp examination. The most important thing to look for is transillumination. This is by having a slit beam slightly smaller than the pupil margin. Directing the slit lamp straight by forcing the light to hit the retina and come backwards. This will illuminate any broken pigment and you'll see this starry effect. Also taking a cross section, you want to examine the lens and the cornea to look for pigmentation. If you have the skills, you want to do a gonioscopy to check the trabecular meshwork. The best way to manage this patient is to refer to ophthalmology. They're going to give 3 courses of treatments: review, medication, or surgical intervention. The medication option is just glaucoma drops. The most common surgical option is iridotomy. This is a small laser hole in the corner of the iris. This causes the bowing iris to flatten, reducing the friction from the lens. Secondary to this, it will help control the intraocular pressure. Other things like tracheoplasty, which is a small laser in the sclera part of the eye to help reduce the intraocular pressure. Hope this helped, guys. On to part 2. If you have any comments or more topics you want us to talk about, leave it in the comments below.